Welcome to Chapter 1, the Introduction to Medical Terminology. What I will do with each of the chapters is run through the chapter lecture slides and information in the book, and things that are important for you to know for the chapter. What's covered in Chapter 1 is an explanation of the importance of understanding medical terms. You'll learn how to define each of the three basic word parts and explain how these parts are put together to make a medical term, and you'll be able to start giving some examples of those. You'll be able to understand medical terms by analyzing their parts and how combining vowels and plural endings to medical terms work. I would highly suggest that you use the pronunciation key to learn how to pronounce the medical terms. I think it's very helpful. I often go back to it because sometimes we learn how to pronounce things that maybe aren't the correct pronunciation. So double check yourself and the people you work with, and even myself quite possibly, to make sure you're pronouncing these medical terms correctly. I highly recommend completing the exercises in the book and using the companion student resources on the point. So why do we use medical terms? Well, really every profession has a range of special terms that are used by practitioners in that field. So someone that works in a health-related area, you'll need to read, write, and speak and understand medical terms as they're used daily in your medical field, wherever you work. And understanding medical terms is also a way to learning about the human body, and you're learning much more than just words. You're learning fundamental concepts about the body and health and disease. It's important to use medical terms versus everyday language. You think, well, why can't someone just say, I've got a stomach ache instead of gastritis? And what you're going to find out is that medical terms are much more precise than everyday words. And what you might refer to as a stomach ache might be pain caused by gastritis, which is stomach inflammation. But it also could be the symptoms of other conditions like a peptic ulcer, which is a sore in the stomach lining. Ulcerative colitis is the inflammation of the colon with open sores, or peritonitis, which is the inflammation of the peritoneum, the tissue that covers the abdominal organs. So we know that medical terms mean very different things to healthcare professionals, and there's usually no simple word-for-word plain English translation of a medical term that conveys its full medical meaning. So you've got to learn the correct terms to fully understand medical conditions. The good news is, though, that medical terminology is not as difficult to learn as it might seem at first. So you might notice that 3 of those medical terms I talked about for stomach pain all ended in itis. And once you know that the word part itis means inflammation, it might be easier to understand the meaning of those terms. And in fact, what you'll learn is many common medical terms end in itis. So learning that one word ending allows you to understand dozens of terms. And you will need to memorize many word parts to understand medical terminology, and you'll need to learn how terms are built from common parts, and then your understanding will grow very quickly. And the focus in this text and in this class is to help you learn new terms and expand your vocabulary. This is a funny little cartoon that makes you scared. The students are obviously scared when they see the teacher saying that you have to learn these definitions and spell these words, but you will find that you will be able to pronounce esophagogastroduodenoscopy and understand what that means as you're saying it by the end of this course, and you'll be happy to know that it isn't as bad as the cartoon shows. What we do know about the how medical terms are derived, it's easier to understand terms if you start learning the basic word parts and where they come from. We know that the earliest medical practitioners generally wrote, spoke, and read Greek and Latin because these were the earliest languages of science and education more than 2,000 years ago. And although few people in the healthcare today can study Greek or Latin, medical language still based on these terms. We know that most medical terms are built from word parts, and so in most cases you'll not only learn maybe some Greek and Latin, but you'll also learn a word root. And word roots are the basic parts of a term, and word roots like gaster, G-A-S-T-R, comes from the Greek word for belly or stomach, or gaster. And a few medical terms built from this word root are gastritis, gastrointestinal, gastroenteritis, gastroesophageal, and gastronomy. So I'm going to show you a picture real quick here, and you can see the gaster involved in all of these word parts. And some medical terms are not built from the word parts, but instead have their origins from modern language. So what this was talking about here is maybe new technology or new treatments are developed, and so that's where their terms are derived from. But other terms are derived from the name of a person who first identified the condition or the procedure. So a term, eponyms, that's what that means. So for example, the eponym is Kaposi sarcoma, and that's a skin cancer name for the Hungarian dermatologist Moritz Kaposi, who originally described the condition. So word parts come again from early languages, modern languages, and eponyms, the person that maybe named them or discovered it. So we're going to learn about roots, prefixes, and suffixes, and we talked a little bit about that, so we can see the word root here in a variety of different ways. So let's first talk about terms through their parts. So what we know now is that we're going to build words, medical terms, through their different parts, so roots, prefixes, and suffixes. We're going to go into great detail of this, and you're going to get really good at identifying this. These parts put together build a medical term, and the term's meaning will come from the meaning of its parts. Let's first talk about word roots. So a word root is the core or main part of the medical term, and most medical terms have a word root. So think of a word root as the word stem, and that's the word root without a prefix or a suffix. And in most cases, you're just going to have to memorize the meaning of the word roots. You probably already know some of them. You know, if you've been in healthcare or been around someone that talked about healthcare, because a lot of our everyday words are also derived from them. So also keep in mind, sometimes there's two or more word roots with the same meaning. So once you know the root, what the root word means, you'll be able to understand lots of other words that contain that root word. So I highly suggest you do the word root exercises 1 and 2 in the chapter and start memorizing those. But I'll say a few of them here, and be sure to go into the online vocabulary through Stedman's to hear these. So cardi means heart, cerebr means brain or cerebrum, colo or colon means colon, crani is cranium or skull, dermat for skin, gaster for stomach, nepher for kidney, neuron for nerve, ost for bone, pulmon for lung, ren for kidney, and vas for vessel. And you may recognize some of those word roots and common words that you've heard. Okay, so let's then move to prefixes. So a prefix is the word part that comes before the word root, and many medical terms are built with prefixes. Prefixes usually add to the meaning of a term by adjusting or qualifying the meaning of the root word. What you're going to see in this course is hyphens are used to signify prefixes, suffixes, and combining forms. It indicates the placement of the word part where it's being used to form a medical term. So, for example, a hyphen placed after the word part, as in like hypo, means the part is a prefix. If hypo means below, and gastric refers to the belly. So what does hypogastric mean? Then hypogastric means below the belly. Or really hypo, we also say stomach or belly. Another example is the prefix post means after. So post is the opposite of pre. So a post, the term post-surgical refers to something that happens after surgery. For example, post-surgical medications are given after an operation. So you're really going to have to memorize these prefixes and really listen to them. So the prefix a or an means without or not. Dis meaning painful, difficult, abnormal. Inter meaning between or among. Intra, inside or within. Peri, around or surrounding. Poly meaning many or much. Post meaning after or behind. Pre meaning before. Sub or infra meaning below or beneath, and supra or supra meaning above. So practice, use the exercises 3 and 4 to practice your prefixes. So the final part is the suffix. So like prefixes, suffixes are attached to a word root, but they come after the word root. A hyphen placed before the word part is an dash AC or dash ac means the part is a suffix. For example, the suffix ac means pertaining to, so cardiac simply means pertaining to the heart. And the suffix al also means pertaining to, so what do you think cranial means? Cranial. Cranial means pertaining to the skull. So many medical terms are built with suffixes. Suffixes contribute to the meaning of a term by simply adding the meaning of the suffix to the meaning of the word root and to the meaning of the prefix when one is present. So you really got to memorize the meanings of the prefixes and then practice the exercises. I think it's exercises 5. So ac is pertaining to, algia is pain, ectomy is the excision or surgical removal, gram is a record or recording, ism or ia is a condition of, itis, we talked a lot about that already, is inflammation, eum pertaining to body, region, or structure, logi the study of, oma a tumor, and tomi an incision. So get really familiar with those because we're going to see those in every chapter of this book. So I'm going to pause here. Well, I'll try to finish in a short amount of time. So combining vowels, this seems a little more complicated than it is, but you're going to get really good at this by the end of the semester. So a combining vowel is used to add it to a word root to make it easier to pronounce. It's usually an O, an I, or sometimes an E. They're best learned along with the word root to which it's attached. And a word root plus its combining vowel is called a combining form, and that's really what we use in this course. So I'm going to pause here until we get to the next section and go to part 2 of your live lecture.